We're live. Nasser?
Thank you very much. Thank you, everyone, for joining us. And particularly, I welcome our panelist that has agreed to speak today. Well, as it is the topic of today, it's the impact of this crisis, the pandemic that everybody experiencing in the whole world on the people who are marginalized for different reasons. And it could be because of the social, economical, ethnicity, nationality, race, or whatever we can say. The thing is that I myself, that is, well, my name is Nasser Boladei, and representing the Baluch in the UNPO and the president of the UNPO. Thing is that I come from a marginalized group too, where I can see these things that is every day happening with our people, and we see that this the marginalization, the problem of the language. We see that at the same time the operation is enhanced and intensified in these situations from all kind of physical insecurity, where people say that the physical distance you should keep, but the government goes home to people and destroys people's home, take their homes, at the same time creating much more problem. And I think that goes for many national minorities. At this time, these things are being used to kill people, to arrest people, at the same time put them in prison, and instead of making sure that people keeping distance. What we know that in those countries, especially in the countries where the marginalization is very high, in the third world countries. And we are very happy here to have all of you here for this panel. And I will give the floor to my good friend, Mr. Fernand de Varennes, to introduce our first panelist. And so hopefully we will have a good session today and continue the good work that we are all doing after this session to make sure that all people have their right, and the right to survive, and right to physical security and economical security and their culture and language, and having a peaceful world. Thank you very much. Please, Fernando.
Thank you very much, Nasser. Thank you all for being here. My name is Fernando Burgess. I am the head of policy and research of UNPO. I will very briefly introduce the work that we have been doing over the last couple of months regarding the impact of COVID-19 on unrepresented nations and peoples around the world. We have our members, this is an announcement, we have members attending this session, and also this is being broadcasted live on Facebook. So hopefully after we have a panel of experts, excellent speakers that we are very thankful that have accepted to speak today. After my very brief presentation, we will give the floor to the experts. And following that, we should have some time for members and anyone attending to ask questions. If you do have questions to the speakers, please raise your hand virtually, as we're now all obliged to do in these times. Everything is virtual, so there is a system here you should be seeing that you can raise your hands. And then my colleagues who are moderating behind doors, they will take your questions and we should be able to proceed. So very quickly, I just wanted to set the ground and explain why we're having this discussion before we go over to the experts. So when the coronavirus pandemic took the world by surprise, when everybody was still trying to understand what was happening, that was around February, early March, we very quickly understood that the UNPO members and all the other nations and peoples, unrepresented nations and peoples in the world, they were being disproportionately affected by the virus, by the pandemic. So we very quickly put together a campaign called Unrepresented Alone, and in which the idea was to monitor on what was happening and the level of impact on our members across the world. And we understood that there were different levels of marginalization, and therefore different members were reacting the way they could, but they were being impacted differently. So because of that, we separated this campaign, or we created subsections by analyzing first states with limited recognition, such as Abkhazia, Kosovo, Nagorno-Karabakh, Somaliland, and Taiwan. because these states with limited recognition, they have different approach, well, the way they can do this approach, but they are operating on the fringes of the international system to overcome the pandemic. But the problem is that their exclusion from international institutions has been detrimental to their ability to respond to the public health emergency. And this is particularly acute in their lack of access to international funding due to their lack of recognized statehood. So then we monitor this, these states with limited recognition, and we have a briefing on our consultation paper. Then we have a special category for government in exile, in which Tibet is one of our members, and it places, they have the Central Tibetan Administration has created a task force to fight the spread of the virus. So we analyzed their performance, a very interesting performance. And then we moved to a more general approach, the unrepresented peoples in general, in which we look at the minorities and indigenous peoples. So in this category, we look at indigenous peoples in Bangladesh, the situation in Brazil for indigenous peoples. We look at Cameroon, our Amazonian members who have been engaged in a very difficult situation with the central state, a conflict that has erupted from language issues and now is a full-blown conflict, civil war. So the pandemic has only made it worse. We look at China. We have many members from China. We look at Ethiopia, also a very problematic situation now, particularly for the Oromo people. We look at India, Indonesia, the situation in West Papua, Aceh, our members in Iran, Iraq, Mauritania, Pakistan, Russia, Spain, even the UK, and then we look at the United States. So what we see, basically, the conclusion, this is our preliminary finding, of course, but the conclusion is that authoritarian governments around the world have taken the opportunity to use the pandemic to increase their powers, which is allowing them to exert even more pressure on the vulnerable peoples inside their territory by increasing arrests and detention. We've seen that a lot recently. Then years of chronic underdevelopment in some areas and neglect by their governments have left many unrepresented peoples extremely ill-prepared to deal with the pandemic. So we have so many cases. West Papua, for instance, in Indonesia, the Sindhi and the Balochi people in Pakistan and in Iran. And also the loss of employment has also been a hardship most severe in poorer areas. So for instance, the Juma people in the Chittagong hill tracts in Bangladesh. So even in more developed democratic countries, we have seen governments neglecting unrepresented peoples by denying them effective means to combat the virus themselves. In Washington, I guess everybody is aware now of what's happening in the District of Columbia. The federal government gave far fewer funds to the territory proportionally than it gave to the US states, even though the capital has been the worst affected than most other parts of the country. And on the other hand, the Spanish government sought to combat the virus by revoking powers given to the devolved Catalonian authorities, much to the anger of the Catalonian government, who believed that they were in a much better position and better equipped to deal with the crisis locally. So we're here today. We have an interesting set of experts to talk about that and our members. The idea here is that we are collecting ideas, we are listening, we're learning, and we are taking this original project ahead. The ultimate goal is to inform policymakers on how to better protect unrepresented nations and peoples around the world. So with no further ado, Nasser, if I may directly give the floor to Professor Fernand de Varennes, who has kindly accepted to speak today with us. He is the UN Special Rapporteur on minority issues. Professor Fernand, thank you so much for being with us. The floor is yours.
Merci beaucoup, Fernando. Monsieur le Président de l'UNPO, Monsieur le Secrétaire Général, Ralph, distingués participants et invités, Mesdames et Messieurs, bonjour tout le monde. To everyone in many different time zones, well, good morning, good afternoon, and good evening. So please allow me first to express my gratitude and appreciation for the privilege and pleasure of joining you in the UNPO's General Assembly and this session on the impact of the coronavirus pandemic. And it seems to me that this session's theme is germane, since we are addressing not only the health impact of the pandemic, but also, as has been mentioned before, a pandemic of hate, intolerance, and marginalization, which does not affect everyone equally. Certain minorities and communities obviously are particularly impacted. So perhaps before starting, I should clearly mention that my comments refer only to minorities. My mandate at the United Nations is limited to national or religious, ethnic, and linguistic minorities. And as some of you know, this can include indigenous peoples in some countries where they may simultaneously be a minority, because being an indigenous people and at the same time a minority is possible and in fact quite common. I use this example to point out that being a people and a minority does occur in some situations because they are actually quite distinct and non-exclusive situations. A people is a socio-political category or concept, while a minority is more of a demographic, numerical category, except perhaps to some extent with the concept of national minorities. Putting that aside, what we're seeing worldwide is a growing climate of fear and insecurity, resulting sometimes in an increasingly hostile, intolerant, and even racist environment. An environment conducive to the spread of this, I would call a disease of the mind, that is hate, and which unfortunately around the world leads too often to scapegoating, targeting, and even violence, particularly against minorities. And Fernando referred to this earlier. As some of you know, hate speech, social media, and minorities is also the thematic priority of my mandate this year. And we'll be holding 2 regional forums virtually, obviously because of the pandemic, one for Europe and another one for the Asia-Pacific region, as well as this is going to be the focus of the United Nations 13th Forum on Minority Issues to be held in Geneva at the Palais des Nations. So I hope to present not only a report on hate speech and minorities, but also develop guidelines that highlights the extent that this is first and foremost a minority issue, incorporating also key instruments such as the Faith for Rights Toolkit and the United Nations Strategy and Plan of Action on Hate Speech. Now, first, how and why inequality and discrimination aggravates the vulnerability and marginalization of certain segments of society during this pandemic, mainly minorities, as a matter of fact. We all know that this is the case with older people, the poor, and those with existing preconditions. But there are also minorities, migrants, refugees, and particularly the stateless who find themselves often left out and particularly affected. And this deals very closely with human rights at a number of levels. There are also wider social phenomena, even political opportunism, fueled by the COVID pandemic, leading to situations where you have, we're seeing around the world, stigmatization and othering of certain groups by segments of the population in a surprisingly significant number of countries. We're seeing minorities being increasingly blamed, if not for the origins of the virus, but blamed for spreading it, and therefore being portrayed as threats. This leads to some minorities being feared, and many of you have heard or even experienced this kind of situation. And minorities even targeted by more and more hate speech, and unfortunately, once again, acts of physical violence, some of it life-threatening. This has occurred in Asia, it has occurred in Europe, and in North America, and in West Papua, and I think in many other parts of the world. So this mainly, in my opinion, involves a failure of state authorities to effectively protect the human rights, and I emphasize the human rights dimension here, of those most vulnerable, particularly minorities, migrants, refugees, and stateless, as I mentioned earlier. And by the way, because it's sometimes ignored, it is sometimes ignored that most migrants, refugees, and stateless are also at the same time usually members of religious, ethnic, or linguistic minorities. So very quickly, I'd like to identify three main areas where state authorities are not complying with their human rights obligations and thus aggravating the impact and vulnerability of minorities and others. First off, entrenched inequality, such as when minorities may not have access to healthcare services, no medical testing to identify the virus, or they are not provided information in their own language so that they can be properly informed, obviously, on the measures they need to take to protect themselves, their family, and members of their community. For example, in one recent study in Europe, only 21% of members of linguistic minorities receive COVID-related health information in their own languages. And in the case of migrants and refugees, well, quite often in some countries, as you know, they're simply ignored by governments in a way which, in my opinion, once again, is discriminatory, and they're ignored until it's too late, and the virus has started expanding. Some minorities, such as the Roma in Europe and the Bedouin in some parts of the Middle East, are treated discriminatorily in terms even of basic access to healthcare. Traveling can be difficult, and I have received allegations of certain communities, such as the Bedouin, actually being denied access to health facilities because they're not allowed to travel outside of their community. And this is, let's be blunt and clear, this suggests discriminatory behavior by state authorities. And as I mentioned earlier, there are plenty of linguistic minorities who are little or even not at all informed in their own language by public and health authorities, which, by the way, this should be obvious, but in a time of crisis such as this one, not providing information to deal with the pandemic in the language better understood by minorities is likely to be discriminatory, but more than that, that's dangerous. It's highly ineffective if you truly want to protect all of a country's population, not to actually reach out in the language that these minorities understand better. Secondly, well, there's the entrenched inequality of some poorer minorities, which means that they are particularly vulnerable and marginalized. There are studies in the United Kingdom and the United States, for example, that confirm recently, many of you have heard of this, that Black, Hispanic, and other ethnic minorities are disproportionately affected by the virus, and in some cases, hugely so. Public authorities need to consider the vulnerability of those who are in refugee camps, for example, or the tens or even hundreds of thousands of people who have, where you have no other choice than to live in cramped conditions. Large numbers of individuals may live in the same room or in a very confined space, or cannot afford to buy a face mask or sanitizer, or even do not have access to soap or running water. That's the reality for millions around the world, and this includes even individuals in Europe and North America. So you have situations where the virus can explode in such conditions that affect mainly, it has to be clear, individuals who are marginalized or victims of discrimination, particularly minorities. So the virus can explode unless authorities are sensitive to and act to address this reality, to protect minorities and other marginalized and vulnerable groups. There's another issue around the broader social phenomena connected to the pandemic right now, and this is the increasing hate speech targeting and scapegoating minorities, and linked somehow to the spread of the virus. In some parts of the world, you have Asians, you have Muslims or Roma or Black minorities and others who are eyed suspiciously and blamed as sources of blame for propagating the virus, which easily feeds into this more and more widespread nationalistic and otherizing discourses that have been instrumentalized by political opportunists, nationalists, and extremists. There have been reports, as you know, of attacks against, Asians in parts of Europe, of Roma being threatened because they congregate or they are claimed not to respect physical distancing, of Muslims, for example, being deemed to be super spreaders of the virus in some parts of the world, and so on. There are so many examples that it would be discouraging to actually refer to try to list many of those. Even more worrying, or perhaps as worrying, are some extreme right-wing groups which have started to use the pandemic as part of a strategy to seek wider public appeal and support calling for measures to control the virus, but also almost in a subliminal way that the virus, this is what is being instrumentalized, that the virus affects minority more anyway, or minorities are identified as the scapegoats for the spread of the virus, and therefore they are a threat or they don't belong in the country. So what we're seeing is intolerance and discrimination against minorities on the rise, with denials of their right to equal access to healthcare and information. We're also seeing, and this has been mentioned before also, we're also seeing crackdowns against minority and human rights activists. And in some cases, as you all know, I think, the adoption of legislation during the pandemic, which would allow the disenfranchisement of millions of individuals, even to the point of blocking the operation of organizations, human rights organizations, minority organizations, unrepresented people's organizations, blocking them from the protection of their own human rights or the rights of such as the right of assembly and freedom of expression. Unfortunately, also, as many of you know, some governments seem to be acting as if the current pandemic allows them to suppress dissent, shutting down the internet and other voices of information, prohibiting demonstrations, and even, as I mentioned earlier, arresting human rights activists. Too often, it's also sad to say, hate speech and hate crimes against minorities are still left unpunished at the same time. And all of those elements, which can occur at the national level, can lead to increased tensions. I think in the earlier section today, we've heard that, lead to increased tensions, unanswered grievances, and indeed no way to legitimately raise and speak about issues. So you have unaddressed discrimination and exclusion of minorities in particular occurring. And that kind of setting, in other words, those conditions can create tension and perhaps even eventually conflicts, as we have heard in the earlier part of your General Assembly. So the current pandemic is raising other long-term challenges, and one of these seems to be the reappearance and growth of national first politics and the weakening of multilateralism. And in closing my comments, I'm referring here directly to the human rights architecture around the world globally, which depends on multilateral treaties and mechanisms. If anything, the pandemic should show us the need to strengthen multilateralism. The only possible way to move forward is to address and manage global issues globally. And while also taking, of course, we have to take appropriate and proportionate measures at the regional and local level. it's vital to keep in mind that human rights issues, including especially of the world's most vulnerable and marginalized, such as minorities, are intimately and fundamentally connected, meshed to multilateralism, the multilateral human rights architecture. But what we're seeing here during the pandemic seems to be a weakening of this architecture, which, in my opinion, is a direct menace to the essential edifice of protection on which international human rights depend. And if anything, the horrors of the Holocaust showed near the middle of the last century, there cannot be effective protection of human rights, especially those of minorities, if this is entirely left up to the vagaries of a national government living in isolation and hiding behind its claimed absolute sovereignty. Now, I'd like to finish on a slightly more positive note. There are, of course, attempts to counteract all of these developments linked to the, partially anyway, linked to the COVID pandemic, including the possible support of the Government of Canada for new global tools and platforms to try to contribute to the empowerment of individuals to fight ignorance and to counteract the misinformation and disinformation surrounding the pandemic. This is actually almost as important, as essential as combating the pandemic itself, the virus itself. But also looking more generally at hate speech, and specifically hate speech against minorities, as well as at the United Nations, we have various initiatives. I mentioned earlier the UN Strategy and Plan of Action on Hate Speech and the Faith for Rights guidelines, amongst others. So on this note, thank you for your time. Thank you for the opportunity of being part of this session. Merci, shukran, and especially good luck and continuation with your deliberations and other activities, not only during this meeting, but especially I wish you best of wishes for the 30th anniversary of the UNPO, when you'll be having your next general meeting. Thank you. Merci beaucoup, Fernando.
Merci beaucoup, Fernand. Thank you so much for Nasser.
Thank you very much. I think it's best that you continue. I think you have been much more in contact with the panelists, and I think that's why it was very nice to hear Mr. Fernando de Varennes, because it was particularly very important for us as national minorities, and hearing that the national minorities and other marginalized people, being from the race or class, are being kind of much more marginalized during these times. And hopefully we can use this pandemic to enhance our situation, to create much more awareness that this world cannot be like this in the future. And that's we are much more vulnerable when people are marginalized and they get the pandemic, and if they say they spread it, well, they have no choice, because they are those that drive the buses, drive come and clean at the homes, and work with everything that the people that are in better position do not do it. So if we want to live in a world where everybody is happy, so they have to make sure that there is no marginalized people because of their class, because of their race, because of their color, or because of their language or their religion. Thank you very much. I'll give the floor again to you, Fernando.
Thank you. Yeah, just to add to Nasser's comments, Professor de Varennes, yeah, thank you for this wonderful overview. You have touched on so many important issues for our members, our minority members, particularly the fact that they have found themselves once again being the scapegoats of and stigmatized by fake news and this false narratives, especially in Asia. We have been following our Asian members suffering from that. So I'm sure our members will have follow-up questions, but thank you once again for being here with us today. Nasser, may I introduce Ms. Edna Adan Ismail? We have a wonderful speaker here with us today, Ms. Edna Adan Ismail. She is a midwife and director and founder of the Edna Adan Maternity Hospital in Somaliland, one of our members. She is a pioneer in the struggle for the abolition of FGM, and she is also a former Minister of Foreign Affairs of Somaliland. Ms. Adan Ismail, we're really delighted to have you with us today. It's an honor, and the floor is yours. Thank you.
Thank you very much, and bonjour tout le monde. Eid Mubarak for those who celebrate Eid like us, because in Islam today it's an Eid, it's a holiday. It's a great honor to be joining you today. I'm also delighted to have somebody from my former organization, because I am a retired WHO staff member. I have a long career with the World Health Organization, so I somehow feel related to the whole world. In Somaliland, as we all know, as you probably do know, Somaliland in the Horn of Africa has emerged from a long civil war with Somalia in 1991, when everything was flattened. Hospitals, schools, homes, cities were leveled to the ground. And 31 years ago, when we separated from Somalia, from La Somalia Italiana, we started to rebuild our country, try to put some basic health services in place, very basic access to immunization, access to prenatal care, access to care for those who are injured and sick. A country that has been at war for 11 years, the people spent most of their time in refugee camps. So there were a lot of communicable diseases to try and find solutions for, like tuberculosis, which was rampant, HIV/AIDS, of course, and then the non-communicable diseases. So as Somaliland was emerging from that situation of having to rebuild a country and putting in place a system of health services that could be accessible to the country Somaliland, we were hit, like the rest of the world, by this cruel pandemic, the coronavirus. Now, some countries have had time to perhaps put their services in place. They have a good level of education of the people. They have access to internet. They have access to knowledge. Somaliland, of course, because of its history, was a very, 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 how should I say, forgotten country. Now, when Corona hit, we had no PPEs, we had no health services that were trained to deal with emergencies as severe as the Corona pandemic. When we were given equipment, we didn't know how to use it. We have 3 ventilators in the whole of Somaliland, a country that is as big as England and Wales combined, with 4 million inhabitants. 4 ventilators. Ventilators need oxygen in constant supply. Ventilators need anesthetists who can intubate a patient. Ventilators need people who can monitor the machine and the patient, and the interaction between the machine and the patient, the situation of the patient. So Somaliland, luckily, was not hit too hard by the coronavirus. And that is how we have, to this day, a number of 850 confirmed positive cases, with a loss of 29 lives. Now, this is the tip of the iceberg, because the ones who were tested and that responded positive and who could be treated were in the big cities. What about the rest of the country? Who knows who had what? Who knows what the mortality rate has been? Who knows what the recovery rate has been? And if the capital Hargeisa, with its 1.4 million inhabitants, only has 3 ventilators, you can imagine how lost the rest of the country is. Now, in every situation, the fittest survive. Those who don't feel well, who have the money, who have the means to travel to a bigger health center, bigger than where they are at that time. Those who have passports in their pockets and the financial means to travel abroad and left before the shutdown. What about the poor? What about the marginalized? What about the weak? What about the women? What about the children? Somaliland the situation of Somaliland is one that reflects the image of every nation that has been denied its identity, denied its rightful place in this world, denied access to interacting with the rest of the world because of our status as unrecognized. We don't have bilateral aid. We don't have embassies. We don't have access to whatever little the world has. Somaliland is denied access to that. And the most painful thing, of course, is Somaliland, former British Somaliland Protectorate, is a country that had never been a colony. We had a treaty of protection with Great Britain. When Somaliland became independent in 1960, in June 1960, Somalia was still a colony. La Côte Française des Somalie, the Republic of Djibouti, was still a French colony. Now, when Somaliland, that has been the firstborn, the first independent Somali nation in the Horn of Africa, that was the 15th country to become independent in Africa. By the time we were independent, 40-something nations in Africa today sitting in the African Union were still under colonial rule. And the cruelty of the politics of this world is the world requires Somaliland to gain permission from lawless Somalia, that was still a colony when we were independent, to give us permission to our rightful identity. And the world requests the African Union to give us permission to call ourselves by our rightful name, Somaliland. Now, the world must have been hit very, very hard by the coronavirus. I know it has. Many countries have lost hundreds and thousands of people. We've lost 29, but we've lost 30 years of our existence has gone down the drain. We have been politically ostracized. Somaliland has been a country that has been denied its right to life itself, because denying us our identity is denying us our rights to life. So it's all interconnected. It's all interlinked. And of course, in every society, even in Somaliland, those who have the means have access. Those who don't do not have access. The marginalized, the weak, and of course, who is weaker than women and children? And I'm hoping that the world can hear this message, that the survival of Somaliland, the only country that is peaceful and stable in the Horn of Africa, is also means the survival of the world and the nations who trade within the Red Sea, who are in the neighborhood of the Red Sea. Now, when Somaliland has had to fight piracy, that was rampant in neighboring Somalia. When Somaliland has had to fight Shabab and terrorism and warlords and criminals that were rampant in neighboring Somalia, and we managed to keep a stable country, Somaliland, for the past 30 years, a track record that is often referred to as an African miracle. Very few nations came to the help of Somaliland in our time of most greatest need, when all we needed were two things: protection from the virus, protection equipment, the PPEs, knowledge, and the necessary medicines and supplies and equipment to run health services, to give those that were affected by the coronavirus a fighting chance to survive. Now, where is fairness? Where is human rights? Where is that conscience of the world that denies nations like Somaliland, nations that have been stable and peaceful and a home to many refugees from neighboring countries. We have 40,000 refugees from across the waters in Yemen. We have refugees from Ethiopia. We have refugees from Somalia. And we have displaced people from all corners of Somaliland. Superimposed on all our misery and our political isolation, political cruelty that was perpetrated against our people, Corona hits. Now, I would like the world to think again. Don't forget nations like ours. If the situation of Corona gets out of hand in Somaliland, if the situation of peace and stability gets out of hand in Somaliland, there's going to be 4 million new criminals to prey on the world and on the peaceful trading routes of the Red Sea. All it takes is to recognize the right of the people of Somaliland, the right to their identity, the appreciation of the track record of peace of 30 years, and give us that chance to learn from you, those who know better than we, many, how to fight diseases like tuberculosis, like the corona now. And when was the last time you lost 300 or 400 children to measles? We still lose them to measles. When was the last time nations lost their babies to neonatal tetanus? We still lose our babies to neonatal tetanus. We lose our mothers to postpartum hemorrhage because we don't have the means to stop that postpartum hemorrhage. Our women die of postpartum infection because we don't have the water and we don't have the facilities to sterilize the equipment that we use to deliver them. We don't have health workers available to supply the minimum basic essential care to our people because Somalia, that had put bombs in the air to bomb Somaliland, continues to deny our identity and tells the world, because it has a seat in the UN, that Somaliland does not exist, when in fact it is Somaliland that does exist. And it is Somalia that has gained the title of the most lawless country in the world. And I will leave it at that, and I'm ready to answer any questions. Please look up Somaliland and please look up the history of Somaliland, because that is a country that is worth learning from. The miracle of the Horn of Africa, the miracle that there's only one terrorist in all of Somaliland, and that's me, because I terrorize ignorance, I terrorize injustice, I terrorize all that is unfair in this world. And Somaliland has been dealt every kind of unfair deal for the past 30 years and the 11 years of civil war before that. And thank you very much for the Unrecognized Peoples Organization. Merci, et merci à tout le monde. Et ça me manque de parler la langue française. Ça fait longtemps que j'ai pas la chance de parler le français. Thank you also very much.
Thank you very much. Thank you. Indeed, Miss Ismail. Nasser, sorry, you go.
No problem. I just wanted to add something that's where Somaliland, besides its natural right of its people, has many other reasons to be recognized by the world as an independent country. But I think this pandemic, which we are discussing today, has shown that Somaliland, well, as its people are suffering, as you said, in different diseases, a pandemic has gone there, and it has taken a burden from the war too. People from Yemen, refugees, from Ethiopia, and from Somalia itself has come there. So if this pandemic takes roots in Somaliland, even if it is uprooted from the countries like Sweden and everywhere else, it could go, because the refugees tend to leave those countries where they are much, they cannot have a good living. They can take this one with them too. So this again shows that the world should be, it should create much better mechanism for the people's self-determination and right to choose and to have a peaceful world. As was mentioned before by the UN Special Rapporteur, that it's very important for the world to come together in this situation, to use this pandemic to come closer and instead of creating more gaps, and to make sure that we have less marginalized people in the world and uprooted. We do not need to uproot the people. We have to uproot the pandemic of this marginalization and poorness and not access to the facilities that we need. I think it was very passionate, and I think that's we hopefully all come together and work for this idea that people's representation and self-determination and their right to choose, it is one of the most important things that can help the world to be better and much more peaceful and survive this kind of pandemic in a better way. Thank you very much. Fernando, it's your floor now.
Yeah, I just wanted to add, Mrs. Ismail, thank you so much for such an inspiring speech. I think I can confidently say on behalf of all UNPO members and the Secretariat that Somaliland is a great source of pride to UNPO. The fact that Somaliland is a member, we always reinforce whenever we can, we always highlight that the failure to recognize Somaliland is the failure of the international system as a whole, while at the same time it insists on Somalia. So it's more than double standards. It's a profound, the system is broken in that sense. So thank you so much. I'm sure the members will have follow-up questions. Let's move on, Nasser, so that we allow time at the end. I believe our next speaker is Professor Fiona McConnel. That's correct. Professor McConnel, yeah. Professor McConnell is a professor of geography at the University of Oxford. By far one of our best friends, partners, collaborator in the history of UNPO. A great, again, source of pride to us. Professor McConnell, thank you so much. The floor is yours.
Many thanks, Fernando, and to Ralph and Nasser for the invitation to present very briefly. I'm going to try and share my screen, so bear with me, just to show a couple of slides. Let me see if this works. Oh. All right, bear with me 1 minute. So I wanted to kind of set a bit of context for some work I'll be doing with the UNPO over the next couple of months. So in 2016 to 18, with funding from the University of oh, it's not working.
Yeah, it is.
Oh, it is.
We see the screen. Yes.
On the screen, thank you.
We can see it.
Fantastic. So in 2016 to 18, with funding from the University of Oxford, I worked with UNPO and colleagues at the Tibet Justice Centre to undertake some skill sharing and training for unrepresented diplomats, and to research and compile this report on compromised space, bullying and blocking at the UN human rights mechanisms. So the report was based on survey responses and in-depth interviews, which covered 55 different minority, indigenous and stateless communities. So the report really documented a range of challenges that unrepresented peoples face when doing advocacy at the UN. So this ranged from having their access blocked due to the politicization of the ECOSOC or denial of ECOSOC status, harassment of unrepresented diplomats within UN spaces, from states interrupting speeches to challenging use of terminology to describe homelands, and the systematic labelling of groups and individuals as terrorists. So all strategies used to undermine groups trying to promote their own human rights concerns. We also documented state promotion of government-affiliated NGOs, or GONGOs, which are used in order to counter human rights accounts with government propaganda. And most seriously, we looked into state reprisals against unrepresented diplomats before and after travelling to the UN, including confiscating travel documents, intimidating family members, and arrest and detention of advocates. So in light of the ongoing pandemic, I'm working with Mircea and Anik from UNPO and my colleague Alex from Oxford to examine the impact of the pandemic on participation of unrepresented diplomats in the UN. So this new report will be based on a series of interviews with UNPO members affected by restrictions at the UN, as well as statements and announcements made by UN agencies. And Mircea and Anik have been really monitoring the situation, particularly in Geneva, very closely since March. So I wanted to share just some of our initial findings so far. And again, this is ongoing work, and I will be in touch with other UNPO members in the weeks ahead. So the first finding really is that access to some parts of the UN is being selectively blocked. Members of civil society and minority and indigenous groups in particular are having their rights reduced at the UN. Their participation has been curtailed in ways that the participation of member states, official observers and NGOs with consultative status has not. So this is in many ways a breach of Sustainable Development Goal number 16, and it represents a potential crisis of multilateralism. Now, it should be noted that the President of the Human Rights Council, the OHCHR Secretariat and the Special Rapporteurs are very aware of this situation and have been really proactive in seeking to protect civil society space at a time really when these voices are crucially important. However, in some cases, there's been a kind of active discouragement of civil society groups from attending Human Rights Council sessions in person, and often only selected NGOs are able to participate. So what we're seeing is a kind of significant closing down of space available to civil society at the UN. Notably, the pandemic has also made it a lot harder for those organisations not based in Europe to engage with UN mechanisms, not least because of time differences, but also logistical challenges. We're also documenting the extent to which the cancellation and postponement of various UN sessions and forums has disproportionately affected minority and indigenous groups. This has included the cancellation of side events at the March session of the Human Rights Council, when notably debate within room 20 by member states was allowed to continue, the cancellation of the Permanent Forum on Indigenous Issues in April, and the postponement of a number of UPR sessions as well. There's also been a scaling back of sessions. Some Human Rights Council sessions moved online have been reduced to 2 hours. And the overall effect of this is to limit participation with fewer speaking slots available for NGOs, and to have a kind of a loss of general debates as well, which is a significant drawback. It makes it harder to raise pressing issues as they occur, and we've seen this in particular with situations affecting the Uyghurs and the Catalans. So overall, the cancellation or curtailment of UN forums represents a loss of voice for unrepresented diplomats on the international stage. We've also documented very poor information flows and late communication from the UN regarding cancelled and postponed sessions, and a great degree of inconsistency across UN mechanisms. And this uncertainty as to which events are happening, when and in what format, again has a disproportionate effect on unrepresented diplomats who have very pressing human rights issues that need an urgent hearing at the UN, and they have very limited financial and human resources. They can't drop everything to attend a rescheduled meeting. The second thing that we're documenting is inequalities in provision for remote participation at the UN. So there are a number of disadvantages of this shift to online meetings. There are technical problems and a lack of IT support that unrepresented diplomats don't have. Overall, there are fewer NGOs speaking slots at online events, and features that are normally used in in-person meetings are no longer available. So, for example, webinars have restricted response to complaints, so less participation. There are also significant cybersecurity concerns with using online platforms, which means that some unrepresented diplomats are reluctant to discuss sensitive issues online. The third issue is that meetings are happening behind closed doors. The fact that the physical space of the UN is shut has really significant implications. there's a loss of informal advocacy and networking opportunities, as unrepresented diplomats can't have those really important informal conversations with UN staff and with state missions. So in that way, that the organisation has become a lot more closed. And informal networks are also really key for accessing information about UN events. And in this case, those who are able to attend face-to-face meetings are at an advantage, able to hear about cancelled or postponed events before official UN communications. We're also charting a kind of hierarchy of NGOs coming into stark relief. Often it's only the largest and most influential international NGOs that are getting a seat at the table. But we also want to explore in this work the potential opportunities that the current crisis is opening up within the UN space as well. Opportunities in terms of making the UN more inclusive and more diverse. Because a shift to online meetings has the potential to democratise participation. There's increased visibility and greater access when everything is broadcast online. It also enables participation throughout the year rather than just at the session times. And with this new format, it also has the potential to encourage a younger generation to engage with the UN. And then it might have that impact of expediting shifts within leadership. This is really just a brief overview as to where we're at with this work. And I know we've got a session on Sunday where we'll be discussing this in more detail, but I'd encourage any UNPO members who are interested in engaging with us to please get in touch. And I'll stop there.
Thank you very much. Nasser?
Well, I think it's, thank you very much, Dr. Fiona. Of course, as you mentioned before, she has been working with us for a long time and we appreciate it. And I think has been a great contribution to whatever we have been doing, helping UNPO to further its cause throughout the international community and learning from her experience and classes. And we think that's, we are very grateful and hopefully we continue this work together. To make sure that she is one of those who understand that the marginalized people has not to be need to be marginalized forever, simply because some countries has become independent and some others does not have the same opportunity. We have been talking about the Chinese situation before, and particularly in the presentation after Ralph about this Belt and Road, how it's impacting national minorities. I come from a community, the same thing, and we know that China fought for its independence, but now within itself is creating other national minorities. And we know that China was with the United Nations to create human rights conventions from the beginning. I think I think his name was Chang. I don't remember, but he was instrumental amongst others to write the human rights conventions and the human rights for the United Nations. I think this is what we have to work on the future. What we are learning from Dr. Fiona as a marginalized or an unrepresented diplomats, use those opportunities to tell the world that they should remember what's happened to them, and they should remember that they cannot continue like this, even if you are a large population or other national minorities which are living within your country, like Tibet or others in China or other national minorities in other places in the world. They have to write the same right that you had once to choose against the colonial world. And now in the post-colonial world, actually, the suppression has become much worse. They have the same right, and I think that's what we have to give to the world, to talk about this much more, and we hopefully get this opportunity through the expertise that we learn from people like Dr. Fiona, who are good friends of people who are not represented and suppressed. Thank you very much, Dr. Fiona, once again.
Thank you. Let's move on, and then again to allow for time at the end for questions. Our next speaker, we're delighted to have Dr. Jehan El-Bayoumi. She's a physician, professor of medicine at George Washington University, and founding director of the Rodham Institute. She's here today with us to speak about the impact of coronavirus on minority communities in the United States and the struggles of medical professionals in the District of Columbia. Dr. Gigi, it is really a pleasure. Thank you very much, and the floor is yours.
Thank you. Good morning, everybody. It's almost 10:30 here in Washington, D.C. صباح الخير, كل سنة وانتم طيبين, عيد مبارك. Bonjour tout le monde. First of all, I'd like to thank UNPO for including me in this panel with these distinguished and illustrious panelists, and also a special thanks to Mr. Ralph Bunche, as well as the senator, although it does not have voting rights, Paul Strauss. So I think it's very important to sort of set the framework for my discussion. And I'd like to start off by sort of naming what I believe tie all of us together, whether we are in the United States or developed countries, quote unquote, versus developing countries. The common theme that really ties all of us together when we're looking at issues of disparities, health or otherwise, is really the legacy of colonialism, imperialism, and occupation. Which, by the way, I want to just mention that Palestine, which has been occupied, has also had its share of challenges pre-COVID and, of course, during COVID. Within the United States, really, if you look at the foundation of the United States, I believe that it was founded on a three-legged stool: greed, violence, and racism. And so when you have that as part of the foundation, it is not surprising that structural racism really is baked into the very foundation of this country. And when we look at what's been happening in addition to that, is that you're seeing worldwide, global uber capitalism. I wish we'd go back to just regular capitalism, let alone, social democracy. The uber capitalism in the United States has resulted in incredible inequities. Did you know that an entry-level worker, the difference between his or her salary and a CEO is 400-fold difference? Whereas in Western European countries, the maximum is 40-fold. So there has been a huge disparity and a huge concentration of wealth. I think for a lot of people all around the world, they have actually been shocked at the COVID pandemic and how it's hit the United States. We're now above 150,000 deaths. They are shocked, but of course we're not, who are living here, especially those of us of color. Because what has happened is that there's been an unveiling of the dirty secret of what life is for underrepresented minorities, people who are marginalized for whatever reason, people who have mental illness, disabled, undocumented, LGBTQ, homeless, mentally ill, you name it. There are huge disparities. And so I think that we have to lay out this pandemic as happening sort of in the midst of not just one pandemic, which is COVID, but really two pandemics. One of them has existed for 400 years, and that is the legacy of racism. And I would say that there has been an acute exacerbation, as we would say in using medical terms. So let's talk about that. I think obviously the current administration has inflamed, worsened, and handled this pandemic extremely poorly. I think we can all agree on that. But I think it would be a mistake to solely focus on this administration and blame the woes of the pandemic and the horrible death rates solely on them. There has been a lack of any kind of investment in a meaningful public health system. And that shows very clearly. Everything is focused on technological, and the United States has wonderful technologies and treatments and the latest science. I don't know how accessible it is to everybody, but if you have the means, class or otherwise, to be able to access that, you will get the best treatment. But the public health systems, which are just as important, if not more important, in the prevention of disease, and I'm a general internist, are crucial. And you've seen very clearly the lack of investment in public health systems and the consequence of that. Furthermore, and I would say that this really dates back to the Reagan administration, there has been a systematic campaign for anti-science and anti-intellectualism, so that the public has had an erosion in the trust of leaders in those public health system and intellectuals. And science. So it is not surprising that when what I consider a personal hero, somebody that like Dr. Anthony Fauci gets up and speaks up, that you have a segment of the population who is distrustful. And this is not just attributable to the current administration. Anthony Fauci, just to really, I think he should be nominated for a Nobel Prize, a Nobel Peace Prize. He was a personal hero because I was at the front lines of the AIDS epidemic, and there are lots of similarities in how marginalized groups were treated. I remember when I was taking care of patients, we had wards and wards full of mostly gay men who were dying, and nobody would touch them. They would not take care of them. Some people would refuse to even give them medical care, let alone caring for them in terms of food and just other services. I would be asked to change the reason for the cause of death. There are people that, as they lay dying, were excommunicated and disinherited by their families. So imagine dying alone. I was often the only person that was with a patient dying of AIDS in their room. So that is sort of the framework. And I think it's really important that we look, and another thing actually, which is crucial, is the slashing of funding for research. Did you know that at my institution, Dr. Peter Hotez, who's now at Baylor, was actually working on COVID vaccinations? Of course, not this COVID virus because it's a novel virus, but on the coronavirus in general. He needed something to the tune of $50 million of an investment for the vaccine. And in 2016, with this current administration, that funding was cut. So it is not surprising that we are in this situation. Let's talk about underrepresented minorities. And again, this really holds true for other disenfranchised groups, but it's the most stark in terms of, first of all, let's not forget the indigenous and original peoples of the United States, in which the numbers and the percentage of deaths actually is even higher than African Americans still higher than Latinos. So let's talk about the baseline pre-COVID of health status of underrepresented minorities. Well, before I even talk about that, it's important that we have an understanding, and forgive me if this is redundant for audience members. I just want to make sure that we're all sort of using the language and we're sort of all on the same page. So you cannot speak about health equity and the reduction of health disparities without talking about the social determinants of health. What are these social determinants of health? Actually, as much as physicians, we like to think that we are responsible for people's health. In point of fact, only about 20% of what we do, access to the healthcare system, is responsible for health outcomes and how long people live. 80% has to do with education, the zip code that you live in, the food that you eat, the water that you drink, the environmental sort of pollution, the air that you breathe, and the economic development of your community. So really no different than any other country and for any other people who is experiencing health inequities. If insurance was the only reason that, or was the closest factor that tied with outcome, the District of Columbia would have the best outcomes in the country. We are only second to Massachusetts in terms of insurance coverage. We have 97% of the District of Columbia residents have insurance, health insurance, which is great. That was expanded under the Affordable Care Act, and so that's wonderful. And yet, let me share some extremely sobering statistics. And when I mention these statistics, even to my colleagues that work here, they are shocked. So we have 8 wards in Washington, D.C. This is a 10-mile span, is our city. And we have 2 rivers, the Potomac River, where you see all those beautiful monuments, the Lincoln Memorial, Jefferson, you can see all of these places on the banks of the Potomac River. And then there's the Anacostia River, which actually is a physical separation that separates the 2 poorest wards, wards 7 and 8, from the rest of the city. So Georgetown, you may be familiar with that. That's kind of the ritzy part. Many people, when they come to visit DC, go there. Lots of great restaurants, really very nice, a lovely waterfront where you can stroll, have a meal, really great. If you live in Georgetown, your average life expectancy, average, is 94 years. You can expect to live on average 94 years. If you live in Anacostia, which is in Ward 8, you can expect to live on average 66 and a half years. Can you believe that? Almost 27 years differential in a 10-mile span of how long people live. We have the highest per capita rate of HIV, cancer mortality, end-stage kidney disease in the United States of America. Shocking. Shocking for these kinds of statistics to come out of the capital of arguably one of the richest, most powerful countries in the world. And that doesn't even tell the story, full story, because these are averages. If you look at Ward 8, our HIV rate is the same as Namibia's. If you look at infant mortality, it's the same as El Salvador and Cambodia. So the same issues that Ms. Ismail had so eloquently described in terms of postpartum hemorrhage, maternal mortality, some of these preventable issues, we cope with here in Washington, D.C. So that just gives you sort of the idea of what happens or what's going on pre-COVID. So let's look at some of these social determinants of health. Here, in where George Washington University sits, and by the way, this particular ward, all the university academic medical centers are clustered and concentrated in one area. For Ward 8 and Ward 7, which is about 150,000 residents, there is one sort of city hospital, which has all kinds of issues, not the least of which the physicians and other healthcare personnel don't have the adequate case management, social work, equipment, etc. That had a maternity ward that was closed. So now a woman who lives in Ward 7 or 8 has to come all the way across, maybe 45 minutes depending on the traffic, to deliver. And of course, okay, that's fine if you've got a normal delivery, but imagine if she is having an issue or her baby is in distress. Time is of the essence. There is only one full-service grocery store that serves 80,000 people in Ward 8. Here you trip upon all the different places. There is, Whole Foods, Trader Joe's, Safeway, Giant, all kinds of places. And then the quality of the food that's available, even though I should back up and tell you the history of one of the neighborhoods in Anacostia, Berry Farm, has a very interesting history. Berry Farm used to be the Berry Farm tobacco plantation. And after the Emancipation Proclamation, the freedmen were given 400 acres. And they transformed that into a thriving African-American farming community. After they would till the fields, by lantern, they would walk to where Howard University sits now, and they built it. And at its heyday, 1 in 4 adults attended Howard University. Now 1 in 4 are in the prison system. It used to have so many fruits and vegetables. Actually, some of the older folks that I take care of remember picking apples from the trees to eat. So the idea that people, African Americans or others, are just ignorant about what healthy foods to eat is just mythology. If you walked into a store, a corner store, you will see the cans of beer are this big. They're huge, as opposed to the ones that are sold here in this side of town. The alcoholic beverages, not to mention potato chips. I have never seen that many brands of potato chips lining the shelves, whole sections. There is the displacement of people who are from those wards, because that part of town is beautiful. Lots of trees, and there's an interesting history to Washington, D.C. Wherever Black people are, they get displaced. Georgetown, this very rich area now, actually has the oldest African American church. So this is almost like musical chairs. So people in those areas are so worried when all of a sudden they see that there's a new bridge, or that there is the fixing of roads, or that there is a new health system that's going to start there, because that means displacement. That means displacement. There are all these signs. So I've given you an idea of what COVID, prior to COVID, the situation was. Now, we have been relatively lucky in Washington, D.C., in that we have a mayor who follows the science, Muriel Bowser. I'm actually on the task force, the Reopen DC task force. She's been very thoughtful, but remember, we have very porous borders because we have Virginia and Maryland. We're not a state, but people come in and out. And as Fernando mentioned, the amount of money that this administration has given us as part of the COVID stimulus package has been exactly 3/5, not a coincidence, of the money that has gone to other states. And yes, it's technically true that we're a territory, but as opposed to territories, we also vote, and we pay taxes. We pay taxes, which is key. So the importance of understanding these factors prior to COVID is key. So in COVID, and by the way, I worked for a week taking care of COVID patients in our hospital. Our numbers were not as numerous, although our ICU was full, as our colleagues at United Medical Center, which is in Ward 8. We did have I don't want to even tell you how many ventilators, Ms. Ismail, we have here in our own hospital, because it would be so discouraging for you to hear. Lack of ventilators was not an issue. I know you only have 3 or 4, I know it. We've had so far 581 deaths. 84% of those deaths have occurred in African Americans. But then I told you it's not surprising to hear those numbers, right? I didn't even go into how Black people, minorities, get treated once they do come into our health system because of implicit and explicit bias and structural racism. The DC stats are worse than the national statistics. Right now, the statistics of how many African Americans live in this city has changed. It used to be about 80-something% back when I first moved here in 1985 from Michigan. Now it's about 46%. So it's still 84% of deaths where 46% of the population are African American is just shocking. Right now, 1/3 of the deaths nationwide are happening among indigenous peoples, African Americans, and Latinos. And I believe very strongly that this administration, because of who's dying, whether the elderly, whether people who have, quote, pre-existing conditions, as though that's a moral failing, I believe that this is a passive genocide. I truly do. Just like the physical shackles in the United States have changed to electronic shackles, where the largest growth industry in the United States is the prison industrial complex, I believe, and it's not coincidental, that the way that PPEs are distributed. First of all, they're distributed along Republican state lines versus Democratic states is shameful. So I could talk about the problems. And indeed, when I established the Rodham Institute, which is dedicated to health equity, I said, you know what? There's been enough research on the fact that all those disenfranchised groups have worse outcomes. Sure, we can slice it and dice it and say 50% worse outcomes for diabetes, X% for COVID. But the issue is, what are we going to do about it? And I think that this is really the hope of dealing during this pandemic, is that there have been people who have been working on the ground, not just now, but for quite a while. And this work has really been intergenerational. You have the generation that may have gone through the civil rights movement, although sadly more and more of those people have died, as we just saw with the late and great John Lewis, or prior to him, Elijah Cummings. But you have people of multiple generations working together. You've got the young people with their enthusiasm, the older people who have the experience of how movements have been co-opted, if not dismantled, right, and how to hopefully avoid those pitfalls. And what was mentioned by Professor Fernand earlier about, sort of nationalism and all these. I mean, let's think about what's been happening in the last 4 years. The late Elijah Cummings was, said by this administration, I hate to use the president's name because Egyptians, and I'm sure a lot of other people, and I'm of Egyptian heritage, even though I was born here, if you don't like something, you don't name it. That's why I'm avoiding saying his name. Said that Elijah Cummings came from a rat-infested, filthy city of Baltimore. Where have we heard this kind of words before? Wasn't that what Jews were called in the rise of fascism? And by the way, Jews are being blamed, just like they were for the Spanish flu, as well as other minority groups, for the spread of the virus, the COVID virus. And there's been, of course, hate crimes increase, anti-Semitism, sexism, you name it. You can go on YouTube and see all kinds of viral videos. So in closing, we have to focus on the solutions. And the solutions don't have to be grand gestures. Yes, policy changes are important, with this administration threatening to cut off state funding for schools because people are afraid to reopen schools because there's no plan for how to reopen schools safely on a federal level. When the president threatens to say, we're not going to give you 10% of your budget, which, by the way, goes mostly to children who are poor, who rely on breakfast and lunch at school to eat, as well as disabled kids. That is, as I say, it's a collective punishment. It is cruel, it's obscene, and it's criminal. But you are seeing systems and people at the local level saying, we have to figure out ways where we can no longer be so dependent. When there's a crisis, we pay a bigger price. So what does that look like? Farming, aquaponics, hydroponics, economic development, where you're saying, if you're going to come and build a new hospital in Ward 8, you've got to hire us. There has to be economic development. And tying that to the building of that. Education, which I didn't mention, right now, 42% of children in Ward 8 graduate from high school. If I did nothing else as a physician than to get them to graduate from high school, I would add 10 years of life. 10 years of life. So education, closing the digital divide, because that's really important in telehealth and teleeducation, because yes, it's a great as we've heard, it's a great vehicle, but that further exacerbates disparities, mental health services, and of course, the PPE, as was mentioned. I think this is a good place for me to stop. I hope that we can engage in a further robust discussion, and I really appreciate the opportunity to be able to talk to you this morning.
Thank you very much. I think it was very good. Good final contribution. I think it's also completion of the UNPO's work, what we are doing, making sure that marginals are represented too. And this is what you are doing. And I think, well, many people like us would think that coming from being marginalized in Iran would think go to the US, or many people from Africa and other places that go to the US, maybe it's a blessing to be marginalized in a rich country and powerful country. But as you showed, it is not. It is in fact maybe much more worse, because you see how much they have and how much you don't have. So this all shows that we all have to work together for a betterment of not only places like, Somaliland or in a situation in Kurdistan, but even for the people of the DC. Thank you very much. I thank you. Fernando, please take on.
Thank you very much, Nathan. Thank you very much, Dr. Gigi. It was a wonderful presentation. I really would like to engage in a further debate to make sure, okay, it's 20 past. We were struggling with connection, but our last panelist, Dr. Irma Alicia Velásquez Nimatuj is here. Irma, do you hear me?
Yes, I hear you. Did you hear me?
I can hear. We don't see. Oh, yes. Wonderful. We have video. I'm sorry you struggled to connect with us, but you made it just in time. This is wonderful. So we were having a panel of experts, of which you were the last one. And just to introduce you to the other members of this conference, Dr. Irma Alicia Velásquez Nimatuj, how do I pronounce?
Yeah, it's fine. Don't worry.
She's a journalist, a social anthropologist, and international spokeswoman for indigenous rights. And she has kindly agreed to us today about the impact of the pandemic on indigenous communities in Latin America. I really appreciate you took the time. I know it's early for you, so an extra thanks for that, Irma. And without further ado, the floor is yours. If you could share your views, introduce a little bit about yourself, tell us your journey, and what do you think about the impact of COVID on indigenous peoples in Latin America?
Okay. So good morning or good afternoon, everybody. I don't know, we are in very different places. My name is Irma Velásquez Nimatuj. I am a Maya Quiche from Guatemala. Guatemala is in Central America. We are a very small country, but the 50% of the population in Guatemala is indigenous people. The majority, we are Maya descendants. So also I am a social anthropologist, and also I am an anthropologist. Part of my work is to support and to accompany the struggle in indigenous communities. So this is most of my expertise in Guatemala, but also in Latin America and including Mexico. I have been working in the border between US and Mexico, working with indigenous women that are stick there for many reasons. So about the situation now in indigenous communities, about the pandemic. The pandemic, as we all know, is a difficult and complex time for the world. But I would like to talk about some topics that I consider are very important. The first topic that I want to point out is that this pandemic show for indigenous people how the degradation to which indigenous people have been subject to by capitalism and colonialism. is more evident in the middle of this pandemic situation. And the degradation has a lot of history of disposition, especially land disposition and natural resources. The majority of the natural resources are now in the indigenous communities, in the indigenous land. So the degradation in these communities are very hard before the pandemic. So now with the pandemic, the situation is more complex. So another point that I think is important is the pandemic point out to us that one of the errors of the humanity and of the academia is that the important thing has not been how much knowledge has advanced or how many Nobel Prizes have been achieved in science, but how little this science has been put to the service of humanity. In this moment of the humanity and inside the indigenous communities, this is very important. Because when science is driven by the interest of capital and not by collective interest, it ends up trivialized, isolated in classroom, invited to reception in palaces, or to the headquarters of war institutions, but very far from the people it should really serve. And there the consequences are dramatic for those who have the least. Now in the middle of the indigenous communities, everywhere, but more especially in Brazil, in Mexico, in Peru, you can see the situation. The science is in the hands of the few people, and the consequences is that the pandemic is hitting very hard to indigenous communities and indigenous people. So as you know, the indigenous people has problems with medical resources, resources, but also with human scientists, with doctors. But this is in one hand. But in the other hand, we need to recognize that now the indigenous communities are working together inside them in order to respond this situation and this moment. So this is important because we, in the middle of the pandemic, we can't see only the indigenous people as victims, as a people that are totally dying in the middle of the forest or in the communities. We need to see also how the pandemic is a challenge for them and how them are trying to organize to recover some forms of exchange, food, to exchange animals, to exchange knowledge, to exchange plants, to exchange medicine. So in this context, I don't know now, but in the future, in the next months, we can see how directly or indirectly those forms of internal cooperation will be important for them and will be save many lives inside the community. But one thing is clear in this situation: the weak of the government, the governments in Latin America are corrupt. The majority of the head of them, they don't have the ability to run on those governments. They are part of the elites, the white elites, and they only think about their interest, but not the interest of the indigenous people. So this is another important point. The states are weak, and the state, they don't have the answer to respond the population and to control the wealth inside the indigenous communities. So this is, I think, other point that we need to see. Another thing that is important to outline is this situation, this pandemic. It's not, we don't need to see and to understand as an isolated pandemic from a very far away. No, we need to understand the situation, that this is part of the destruction of the mother earth. For indigenous people, the principal reason that we are confronting this pandemic is because the white businessmen people are destroying the mother earth during long time. And now this is the consequences that all this destruction. So for the reason, inside some indigenous communities, neither the rich nor the poor leaders that are in different spaces try to respond to this situation. In this time, the objective is not only to find the cure for this virus. The objective needs to be how we want to take care of the mother earth. And inside the indigenous community, the people is very clear about this situation. But when you see the newspaper, when you hear the radio, when you watching the TV or read the informs, nobody talk about this situation. We are in dangerous time. This moment is very complicated, and the life of the people, but also the life of the animals, the plants, the forest is in dangerous. So the COVID-19 exposed the fallacy that those who have responsibility and obligation to save the life of their fellow citizens, they don't do nothing. They don't talk about this topic. And another consequences of this pandemic inside indigenous communities is the social division. That is a deep root inside the communities, inside the countries, because some people try to use the support of the government in the middle of the pandemic for political issues, for political interest, not for the interest of the indigenous communities and people. So this is the inside the social conflict is complex, but also inside this situation, the companies are trying to take the indigenous land for extractive business. So no matter is how difficult is the life now inside the indigenous communities, the companies continue to working with the support of the states in order to take the land of indigenous communities. There is many examples in Peru, in Venezuela, in Mexico, in Guatemala, in Honduras, where the companies are working. They never stop in the middle of this pandemic situation. So this is point that we need to remember, and we need probably to continue discuss inside the communities. So another important thing that we need to remember is that we have inside the indigenous communities examples of how to live with autonomy. One of those examples is the Zapatistas that live in South Mexico, and all the struggle that they have since 1994, and they remember us permanently that nothing with us. And now those words are more strong because they remember us that nothing without us is not part of the academic fashion, but because this is part of, we need to work for another world with indigenous elements inside. Because the COVID-19 reveals with pain and drama the contradiction and the injustice of the system against indigenous people and against all the things that the indigenous people have been denounced for 500 years without being here. And now all these pauses as a consequences of the virus, are important because they give us the ability to rethink the future. And I don't know, I think it's difficult to work with the elites. I am from a very small country where the white elite is small but is very strong, and this is one of the challenge in the middle of this pandemic, but this is a challenge in the future. How these small elites will be understand the situation that now the people that live in the communities are confronting, but also how they understand the dreams of the indigenous people, how they could understand those words, nothing without us, and this is important. And also one other point that I want to share with you is the work of the indigenous women inside the communities in the middle of this situation. The women try to keep working, try to take care of the land, take care of the family. Also, they are contribute to the community in this moment in different levels, in the organizing, in the distribution of the food, in the working for the health element, and also share the knowledge with and exchange knowledge with other women from different communities. So the women right now are playing a key role in the middle of this pandemic. It's the same situation with the youth. The youth in the communities, the indigenous youth also, they have a very key role, because the youth use and all the new phones, all the social medias, and through this they are connected with other communities, and this is a possibility to exchange the situation and to exchange the knowledge between one community to another. But let me finish. I don't have more time. Let me finish with some points. This pandemic will be finished in the next year or in the next month. We don't know exactly. But some situation inside the indigenous communities will be there. For example, one of the most terrible situations is the disposition by extractive companies, especially mining and oil production. Probably the oil production will be down because the prices in Wall Street are down, but we don't know exactly. But the mining is a very big problem. So the majority of those companies are in indigenous communities. So they will continue to destroy the motherland. So we need to open eyes about this situation, because the life inside indigenous communities will be worse. Right. Latin American and indigenous communities has the more high inversion in mining right now, and those are in indigenous communities. The other point that I would like to address is the threats to indigenous people for infrastructure and power generation projects. This is a massive and extensive constructions inside indigenous territories. So we need to think about the impact in people, the impact in the forest, the impact in the animal, the impact in all those territories. The power of the electrical companies, the telephone companies, the energy transportation, the installation of towers, the hydroelectrical plants, the power of those companies is incredible. They have the ability to buy any government, any president in Latin America. So we need to keep the eyes open. The third point is the agro industry. The agro industry, the livestock and large scale monoculture planting is also part of the destruction of the indigenous land. The impact in the life, in the health is worse than the COVID-19. It is worse. So the production of soybeans, African palm, banana, sugarcane, livestock, and other bring with them an environmental impact that destroy the forest and contaminate the water resources. So no state, rich or poor, from the first war or third war, respect the right that the indigenous people has on their territories. So the Convention 169 for the International Labour Organization and the consultation has been prostituted by the state and by the company. And the fourth threat against indigenous people is the criminalization of the defender of the rights of the mother heart. Now, in all Latin America, a lot of defenders are killed, and only in 2015. 185 were murdered, and the impunity is 100%. So I don't have more time. My time is finished, but I would like to finish with this. The pandemic is worse now inside indigenous communities, but all the destruction is not new, and all these threats that I mentioned is worse than the pandemic. So we don't need to talk only about the pandemic, the COVID-19. We talk about the other issues that also are worse for indigenous people and will keep them when the pandemic will be disappear. Thank you so much.
Wow, thank you so much. Muchas gracias, Dr. Velásquez Nimatuj. This debate would not be complete without an indigenous voice to talk about the issues of indigenous peoples. I believe with you, with our panel of experts, we have managed to build an overview where we spoke about minorities, we spoke about the struggle of states with limited recognition, we spoke about the difficulties of territories that are disenfranchised. And with you, with this brilliant presentation, we have now covered a little bit of the struggle of indigenous peoples. So, muchas gracias otra vez. Si usted puede quedar con nosotros un poco, we will have so we have lots of questions and interventions from members. We have a line. Let's try to organize this. Let me just share with you that in theory, we could be kicked out, all of us, including me, from this debate, because in theory the time has expired, but it didn't happen last time, so we might be able to run an extra 30 minutes, let's hope. So in case we all fall, I'm sorry in advance, but fingers crossed we can have this debate now. I will ask the help of my colleagues Lucia and Mercé, who are on this side of the screen. Do we have, Lucia, do we have a list? Let's run first members and interventions, and then if we have time at the end for panelists to react to that. Lucia. Okay. Who? Lucia? Sorry, I cannot hear you.
There she is.
Sorry, just a second.
Well, thank you very much.
Oh, yes, we have Bo. Please, Bo.
Yes, hello everyone, and greetings to all the other members from Taiwan, where it is now late at night. So good night, but also good morning and good day to everyone else. And I want to thank all the panelists and for their great presentations, but also for the UNPO for setting this campaign and setting this topic, unrepresented and alone in the coronavirus time. Very, very worthwhile to discuss. And here in Taiwan, as some of you may know already, we have probably the best anti-coronavirus measures in the world. And I'm sort of almost embarrassed to say it. I mean, we're hardly suffering at all. You know, we have only, I think we have 7 deaths total out of a population of 23 million and no community transmission now for months. It's basically extinct. A lot of the credit, of course, you know, Taiwan is a relatively well-resourced country, economically vibrant and relatively large member by UNPO standards, but not necessarily richer than, say, Catalonia or DC. but somehow producing better virus results. And part of the credit, of course, most of the credit, of course, is from the public health establishment, which is very well run in Taiwan. We have good universal health care system and other things which, in theory, all countries should have, and but it's not easy to put in place. It takes a lot of resources. But I just wanted to say, I think one of the things that is a bit special for UNPO is that, of course, Taiwan is not allowed to go anywhere near any WHO meetings. We're totally excluded from all such. And that's why we're members of the UNPO, and we note that the UNPO has been trying to lobby for that, and we appreciate that. And some of the UNPO members, like Guam, have been lobbying for that. So I think one of the lessons that we want to say is that although international cooperation it should be important, and it should be it should work very well, and we wish it would work better for people, but self-reliance is also important, and I think part of the reason Taiwan did so well is actually because we're not in the WHO, because we didn't wait for the WHO's information to start taking action. So we had our own source of information. We were monitoring the situation on Chinese social media, and then we're able to take action faster than the WHO would have recommended, actually. So I think that's part of the lesson, that these international organizations, yes, we try to reform them, we try to make them work better for all the peoples of the world. They suppose they have health for all in the UN, in the WHO, but how many people are excluded, right? Including almost all of us here today. But all these organizations have their politics, and they have their blind spots. And if you're on the wrong side of the blind spot, for example, if your virus is coming out of a powerful member like China, then you can expect that the WHO or the UN, whichever agency it may be, will react more slowly or not at all. They will try to minimize the problem to please the big, powerful countries. So in that sense, we need to be a little bit self-reliant and try to take care of ourselves and take care of each other, but not waiting for the UN or the WHO to act. So I think that's the main specific message that I want to share with the group. I had also, thinking about some of the presentations, I did want to hear a little bit more from, especially from Dr. Edna in Somaliland, but maybe also from either the Mayans or the people in DC, that about some positive experiences. I think we should share. We know all about how we were excluded and marginalized, and therefore more vulnerable to everything. That's for sure. But I think there are also creative and interesting solutions that are happening with people without waiting for the international community to come in and provide assistance. How we can find ways to defeat the virus or defeat other kinds of challenges with our own internal resources, empowering ourselves. So I'm looking forward to further discussions in the future about that kind of thing. Thank you very much.
Thank you very much indeed, Bo. Let's listen from another member before we go back to our panel of experts. Lucia, could you? Just a second. There's someone lined up. I'm sorry, just a second, everyone. We have Senator Strauss. Senator?
Hi, can you hear me?
Yes, we can.
Okay. Well, one, I just wanted to thank everyone for their participation today. That's better. I was getting two signals.
Yeah.
You know, when DC first joined this group back in 2005, people were actively mocking us in the international community, saying, how does a group of Americans pretend to be as oppressed as people from Kurdistan and other places, and what a stunt it is.